Myth number 6. I have allergies, so I shouldn't get the COVID vaccine.
The CDC actually has three categories, okay? People who have no contraindications, which means there's no reasons they shouldn't get it, and there's no precautions. And so those are people like airborne allergies, pet allergies, food allergies, and even if they're allergic to like an oral medication like penicillin, okay? And then they have people who have what they call precautions. And those are people who have a history of severe allergic reactions called anaphylaxis, or if they've had a history of allergy to vaccines or other injectable medications. Those are people who should stay 30 minutes after their COVID vaccine, okay? And then there's a very, very tiny amount of people who have what they call contraindications, which should not get the vaccine, and those are tiny, tiny. And that's anyone who's had a history of anaphylaxis to a specific COVID vaccine or who has an allergy to a component in the COVID vaccine. There are 2 mRNA vaccines. One is made by Pfizer and another one made by Moderna. If you've had a severe reaction to either one of those, you should wait at least 4 weeks and then receive what they call the Johnson & Johnson one, which is a different technology altogether.
Now, I know that some people are worried about what happens to me if I have an allergic reaction after the COVID-19 vaccine. Well, there are safeguards in place. These centers do have the materials and the people who are prepared to treat those allergic reactions. The CDC has said that they should be able to handle these reactions. Furthermore, the chance of you actually having an anaphylactic reaction to the COVID-19 vaccination is very, very low. You are more likely to be struck down by lightning than to have an anaphylactic reaction to any vaccine.